I'm the president of the Mental Health Awareness Coalition. I am a peer. I'm a family member. I've also experienced homelessness as a child. My mother struggled with mental illness, and there were many times as a child that we were homeless in a car. So it's something that's personal to me. It was very difficult for her to maintain housing. And if we didn't have a large support or family network, I mean, I don't know what that would have looked like. So luckily we did have a large family that supported us when they could. I also work at Copa Health. I am a program manager for a peer and family support program, and we work specifically with individuals, keeping them housed and independent in the community. So this is something that's near and dear to personally and professionally. So thank you. And next I'll go off to Michael.
Hi, I'm Mike Beltran. I work with Copa Health in the in-home supports department. I'm the credential family support partner, and I'm also a peer. And I have my own personal lived experience with navigating trying to get into housing and what that looks like on the criminal justice side of things. And I'm also the vice president of the Mental Health Awareness Coalition. And yeah, I'm glad to see everyone here today.
Awesome, thank you, Mike. Just for some clarity, someone had asked a question about where they're asking those questions. And yes, it's in the Q&A. Feel free to pop those questions in there. So thank you, great question. Next, let's go to Joanna. So I'll just go down the list here.
Thank you. Hi, everyone. I'm Joanna Carr. I'm the Research and Policy Director with the Arizona Housing Coalition. We're a statewide organization that advocates for safe and affordable housing for all individuals in our state. And we do this through state, local, and federal advocacy, education, and coordination of statewide partners. My role is focused on local level policy solutions to end homelessness. And I also have a background in working with direct services with individuals experiencing homelessness, both here in Arizona and also in the UK. So that's me, and thank you for having me here today.
Thank you, Joanna. David, you're next.
Good afternoon, and thank you for having me today. My name is David Bridge. I'm the Director of Housing Programs for the Arizona Healthcare Cost Containment System, or ACCESS. I oversee our portfolio of about 3,000 permanent supportive housing units for persons with serious mental illness, some general mental health and substance abuse units in Arizona. Prior to my experience at ACCESS, I've been here about 2 years. I worked for Arizona Department of Housing as the Balance of State Continuum of Care Coordinator, and want to make sure we always speak to the needs of our whole state, including our rural areas. And then also before that, I had over 20 years experience as a direct service provider. So thank you for having me here today.
Thank you. Dawn.
Good afternoon, Arizona community. I'm so happy to be here today. A little bit of background, I am a registered nurse. I teach at ASU in the College of Health Innovation and Nursing. Also, I am a peer and an advocate, and advocate greatly for the Arizona Peer and Family Coalition and Career Academy. Most importantly, though, I am born and raised in Phoenix, and my heart is greatly driven by improving our beloved community and elevating the connectedness that we have within our community. And for decades, I've seen loved ones cycle through our mental health system, and that's what drives my passion to stay connected to service providers and to improve. So thank you for having me.
Thank you, Dawn. Next, let's have Joe.
Hello, hi, I'm Joe Tansel. I'm the Executive Director at Paz de Cristo, located in Mesa, Arizona. We are an outreach program to those experiencing homelessness or any kind of food insecurity or severe poverty. I come from a background of public service. I worked for Maricopa County in healthcare management, as well as the state of Arizona with Department of Economic Security, and have just recently joined Paz de Cristo as the Executive Director.
Thank you, Joe. Andy, you're up next. We can't hear you. Are you on mute? The statement of the year, right? I'll move on to Vanessa and then you can come next. Vanessa, you go ahead.
Good afternoon, everyone. My name is Vanessa Carthel. I'm the Director of Housing at Arizona Behavioral and Health Corporation. We provide permanent supportive housing services to persons who are experiencing homelessness and also with behavioral health concerns. So whether they have a serious mental illness designation or general mental health substance use, we really specialize in serving that population. And just glad to be here today to talk about this very important topic. Thank you.
Thank you. Liz.
Yes, hello, can you hear me?
Yes, you are good.
I'm Liz DaCosta. I'm the Senior Director of Housing and Community Integration Programs with Community Bridges. So it's an extension of our crisis services and really a department that focuses on addressing social determinants of health of those that we serve. We manage over 50 grants from outreach to shelter to permanent supportive housing programs. I also am in recovery myself, and we have about 150 peer support specialists in our department working to provide those community-based services and just give back to people that, you know, are struggling and in a position that we once were.
Thank you, Liz. Andy, you got it? Okay. We also have Michelle. She's not going to pop on, but she's going to help with the chat. She's one of the board members of the Mental Health Awareness Coalition, so she's helping with that as well. We'll give you another second, Andy. You got it?
You got it? I think we got it.
Okay.
Sorry about that. My name's Andy Wambach. I work over at Mercy Care in the housing department. I've been here for almost 2 years, and prior to that, I had the pleasure of working at the Human Services campus for about 4.5 years, working within Maricopa County's coordinated entry system. And so that's a really complex system, collaborating providers to be able to assess, prioritize, and refer individuals experiencing homelessness to various number of permanent supportive housing resources, as well as rapid rehousing and kind of some other resources out there as well. So happy to join everyone today. Thank you.
Thank you, Andy. We're glad you're here. And thank you everyone again for taking the time in your busy schedules to talk about this and share your experiences with the community. So moving on, the first thing that we kind of wanted to talk about was some statistics. So what we know is as of January 2019, Arizona had an estimated 10,007 individuals experiencing homelessness on any given day, as reported by the Continuum Care to the U.S. Department of Housing and Urban Development. 745 were family households, 910 were veterans, 587 were unaccompanied young adults aged 18 to 25, and 1,876 were individuals experiencing chronic homelessness. Arizona has the 14th largest homeless population in the country. The massive impact of COVID-19 has significantly impacted the homeless population. No permanent address. So this is a myth that we wanted to first open up the conversation about. So homeless individuals are lazy and just don't want to work. So one of the things that we know is that there's no permanent address. There may be issues with identification. There may be some domestic violence survivors, cleanliness, no phone number, no transportation. So as we open up this topic, the first question that we have for the panelist is, if we look at those concerns and those things that we brought up, specifically, what are you seeing in the community that maybe someone else, could impact someone from getting employment? And we wanted to start, I think, with Joanna. No,
Oh,
Andy,
yeah.
Andy, I apologize. I'm going to throw you out there, Andy.
Yeah, no worries. I'll kick us off here. So, yeah, I mean, I think as you outlined, there's a lot of just different things that people assume and say, and until you've actually kind of walked in those shoes, it's really tough to actually know what's going on, right? The number of reasons someone may be experiencing homelessness, as we know from data, is really vast. And so, you know, and I think just one thing we've talked about, right, in relation to the job thing and implying that folks are lazy because they're homelessness, just go get a job and that'll solve all your problems. I think we touched on previously just about how surviving on the streets day to day is not just something that you can take for granted, right? Where's your next meal going to be? You know, just doing really simple things take, you know, 3 times as long. You know, things you take for granted, like having that source of identification in your pocket, you know, that's a process in and of itself. And so I think just to kind of wrap things up on my end is from Mercy Care side, really trying to address those folks that do have that will to be employed and want to work, but maybe just need a little bit of help, connection to resources. We, for our individuals with serious mental illness determination, we offer employment rehab specialist supports at every clinic. So folks that are interested can get connected with that individual, talk to their team about what they're feeling, and then really from there, kind of holistically take inventory of what that person's skills are, what their interests are, and really try to build out their needs. And then from there, not just set it and forget it, right? Continue to provide ongoing support once they get that job, you know, be able to maintain that employment and keep that going. So that's one thing at Mercy Care, I know that we're really happy to roll out into the community. There's been a few studies done on it as well, or at least one large study called the NORC study, for those of you that are interested, done through the University of Chicago, just on Maricopa County and Mercy Care's employment services program.
I'd just like to add, I'd like to maybe take a step back to the assumption that, you know, again, this comment about lazy and work is the starting point for solving somebody's homelessness. I think, as Andy kind of pointed out, I think there's a famous quote, you know, that you sometimes hear Bill say, like, if you know one homeless person, you know one homeless person, right? And then you really get into the range of issues that we could play this game all day, is just take turns giving things that cause homelessness. So we know poverty is a factor. We know that, you know, we probably could guess just by looking sometimes that there may be mental health. We know that there's a disproportionate probably substance abuse issue, and whether that's the cause or a result of the homelessness can be debated, but we know that that can be a barrier for people. We know unemployment and work and the challenges that that can present. And again, we can keep going: domestic violence, youth transition out of foster care, issues around gender and sexuality. LGBT kids tend to be more highly represented in the homeless population than other groups. We know there's racial disparities and inequities in this. There's a lack of housing. You know, homelessness at its root is a lack of housing, and just the fact that there isn't enough permanent housing out there, affordable housing for people, are all factors. And so I guess the first thing that I would just say as a human being and as an advocate is, you know, really don't judge. You know, when you see somebody on the street, or even if you're in the position to provide some type of help, you know, start by reserving judgment, you know, because you don't know what that circumstance is. And a lot of times, even the things you think might be the issue aren't the primary issue. When you ask the vast majority of people why they're homeless, they don't say it's because of their mental health or their substance abuse or these, you know, let's just say, for lack of a better term, like personal issues, usually it comes down to lack of housing. They couldn't afford housing. They couldn't afford, again, maybe the reason goes to a deeper issue around substance abuse or mental health, and it's kind of a chronic issue because of that. But the starting point is to not judge and to let the individual determine what it is they need to address to get back into their housing. The other thing in terms of myths that I want to that point that I'd like to just put out there, traditionally, the vast majority of people who experience homelessness for a very short period of time. Vast majority, I think, from the numbers, and this is before COVID and some of the housing crises, but the general number I've always seen is somewhere between 70 and 80% of the population that hits homelessness will experience homelessness once, will self-resolve almost with no assistance at all, other than maybe what they get through a food bank or maybe some, short-term financial assistance or a couple days in a shelter. And then they go back into the community and we really never hear of them again. Unfortunately, there's also a group that, because of chronic mental health or substance abuse or co-occurring issues around physical health and these other factors we talk about, end up being in the system for very long periods of time. These are kind of your stereotypical, I hate to say stereotypical, but when we think about a homeless person with the mental health, that's a much smaller percentage of the population. And again, because of those chronic issues, they tend to be homeless much longer, have higher costs, have higher health needs, take more to engage because they have some of those barriers. But I guess I would starting by undermining that assumption that it's just a matter of personal will and employment or just economics alone, but there's these much deeper factors. And again, our starting point needs to be with that recognition and that suspension of judgment, if we're really going to help and solve this issue. So thank you.
Definitely, David. Yeah, and you brought up good points of we're human and connecting on that human level. Joanna, would you like to share?
Yeah, sure. So I think David and Andy both really described really well, the practical issues of trying to find work and the barriers to that when you don't have a home. Housing is a basic need, and when we don't have our basic needs being met, then how can we have the energy to attend work and hold down a job? And the housing first model really makes sense, I think, to this conversation, in that once we have housing and we have that safe structure around us as a base, we can then, move forward on finding work. But as David mentioned, the problem is that we just simply do not have enough housing. And so I think that we have to move away from this blaming and stigmatizing language that, unfortunately exists around this issue, and recognize that until we have enough affordable housing in our state, then it's going to be very difficult for us to move forward with issues such as, finding and sustaining employment.
Yes. Dawn, you have your hand raised. Would you like to share on that as well?
Yeah, I'd just like to kind of add to the great points that have been brought forward and, dispelling this myth that, a person that is currently homeless is lazy, and they're in that state because of laziness. And, there's an extreme burden that is carried by a person that is trying to navigate services to get themselves out of homelessness, much like a term called treatment burden that we know that people have when they are experiencing co-occurring chronic physical illnesses that are also, made intensified by a co-occurring mental illness or condition. And so navigating these services and trying to work through all of this alone is extremely burdensome, extremely overwhelming. And so that's what a great plug for the importance of our peer support, peer navigators, so that our brothers and sisters living on the streets have somebody that can help lessen that burden of the experience that they're going through.
Yes, thank you, Dawn. One of the things that we did to kind of prepare for this, the coalition, we actually went out and interviewed and met with individuals that were experiencing homelessness. And there was one specific story that kind of was really poignant. And he said that he had a very difficult time getting employment, being homeless. And he brought up a lot of those issues that we talked about. And he provided us with a scenario that happened to him like a week prior. He had went out, he had got some money by panhandling, got some new clothes, he had got a job, he had got his driver's license, he had got everything ready. He was starting his job. That night, all of his belongings were stolen. And he couldn't go to work without a social security card and ID, which was part of his belongings. And so he couldn't take the job. And so he was like, this was a good job. It was gonna, get me off the streets. But he's like, you never know, like anything could happen. So it looks like we have a couple participants that want to ask some questions. Let's see. Liz, I'm going to go ahead and let you go ahead and share your part here, and then I'm going to let one of the attendees, it looks like Vicky Staples would like to share something, and I'll bring them on. Okay.
Sounds great. Yeah, thank you so much. Just I wanted to share from an outreach perspective just how beneficial the connection to St. Joseph's the Worker has been. They really specialized in employment services for individuals experiencing homelessness and can help with purchasing steel-toed boots or different tools for the job. But recently, through some of the COVID CARES funds, have also gained access to certain hotel units. So individuals who are seeking employment or recently employed can move into their hotel and to continue on with their employment work and until they're able to get into an apartment on their own. I wanted to just share that.
Thank you, Liz. Yeah, St. Joseph the Worker is a great resource. One of the things as well, any of the resources that we bring up during this or any of you, we're going to collect that and send all of the attendees and all the panelists the resource guide that we're putting together from this event. So thank you all for sharing those. Let's go ahead and go to our attendees. Did Vicky remove her hand? Maybe she did. Okay. She must not want to say anything. Okay, so we'll go ahead and move on. The next thing that we wanted to go over was just the resource piece. So I know that Joanna, you have a resource directory, correct, of stuff. Is that something that maybe we could share in the chat?
Yeah, absolutely. Do you want me to share the link?
Sure, yeah, that would be great. Yeah.
Okay, I'll find that right now.
And then Joe, do you want to share kind of what resources that Paz de Cristo has out there, maybe the connection you talked about with Mesa and stuff like that?
Sure, thank you. So Paz de Cristo is really, we're primarily a crisis intervention center where a lot of people come here that are experiencing homelessness, maybe for the first time, or are chronically homeless and are coming routinely back to dinner. But we receive people here every day that are newly homeless, are extremely, scared of their situation and what's going on. And they know of us because we primarily outreach to the homeless, and we provide a hot, nutritious meal here every night of the year, 365 days a year. But I think it just starts with, meeting their immediate need with hunger. Then we can connect people with a lot of other resources. We partner with Copa Health and Community Bridges. We work with St. Vincent de Paul. We have here on site, we have a jobs program right here on site that we can help people search for employment. And as all the other panelists have said, each individual is very unique. And David brought up, 70 to 80% of individuals are homeless for a short period of time. But then there's other individuals that have a lot more complex issues. So, you can't treat one individual the same as the next. They're all very unique. Their particular situation is unique. So, yeah.
Thank you, Joe. Thank you. Does someone have to be a resident of Mesa to take advantages of the services, or can it be anybody in?
Yeah, so really we serve anybody that comes to Paz de Cristo, and really people come from all over the state, including, up north and on the reservations. We serve about 7% of the population that we serve is Native American here, and they come from all over the state. So, and then we have, individuals that are passing through Arizona and come here as well. So the vast majority, though, do come from the East Valley since we're located in Mesa.
Well, thank you, Joe. Yeah, I grew up in Mesa, and my mom and me and my little brother waited in line at Paz de Cristo for food when we were younger. So we're glad you're still around.
33 years going
Yep.
strong.
Thank
Thanks.
you.
One quick,
Yeah, go ahead, David.
just a quick comment on resources. One of the real challenges on resources, you'll see this when you see something like the coalition's resource guide, is there's so many different sources depending on a person's needs. And if you're a veteran, you qualify for some programs. If you have certain income levels or you belong to certain groups, you may qualify for some programs or others. And I might ask some of the other providers their guidance on this. But one of the things HUD has been trying to push is this idea of a coordinated assessment or a coordinated intake strategy. I know that statewide they've been pushing out these strategies so that that people can call or go through one kind of assessment process or intake process, and then to the best degree possible, that gets them access to shelters or gets them access to housing wait lists or housing programs targeted to homelessness. I know Andy was heavily involved in that process in Maricopa County, and I know a lot of the other stakeholders here have some experience with that. It might be a good thing just to maybe give a couple minutes just to explain how that works and because sometimes it's a good place to just start if you have no other idea when you're experiencing homelessness.
Sure.
And sorry to put people on the spot.
Real quick before we move
I
on to that, someone had a couple questions for Joe. Joe, does Paz de Cristo work with families or more with single adults? And then does Paz de Cristo still offer the shower program?
So yes, and yes, and
Okay.
yes. So
Okay.
we do offer the shower program. It's right now just once a week on Wednesdays from 9 a.m. to 1 p.m. So a 4-hour window. And it's one of the most popular services on campus. And it is life-changing for people that haven't had a shower for a little while. So, but we serve anyone that comes to Paz de Cristo, and I've seen generational families with grandparents, their children and grandchildren coming to Paz de Cristo, as well as, a lot of individual, younger individuals, middle-aged and seniors. So we serve anyone that comes that needs some help.
Thank you. Thank you, Joe. Okay, David, let's open that up to the group, and then we're going to probably have to move on to the next point.
Yeah, I was just going to add, I think we had a little space holder towards the end of the presentation, so I can sort of just talk through some of the coordinated entry stuff if we wanted to move on now. Okay,
sounds good. So we do have a lot of resources that we put in the chat, so feel free to take those. And then one of the attendees had also shared the supported employment program. So, we have like Copa Health has a supported employment program, which also you can get referrals not just through the behavioral health system, but also Voc Rehab. So it doesn't have to come through behavioral health. I know that there's Beacon Group. I know that there's other organizations that provide that. There's the Dress for Success program. So if there's someone's having, barriers with clothing, and then there's the Career One Stop, Arizona at Work, and Job Corp. So there's some really cool programs that like Arizona at Work and Job Corp do. Like we were trying to get my son into a free CDL program. It's free. They pay for you to get your CDL license for this $3,000 class. So if you go to there's a lot of different educational kind of job opportunity resources too on that Arizona at Work and Job Corp program. So thank you. So with the next topic here, Andre House has reported, this is a report from them, a service provider adjacent to downtown human services. So they provide resources in downtown area. It's near the encampment area that you'll see if you go downtown. 25.7% who were experiencing unsheltered homelessness between November 2018 and March 2019 identified a diagnosable substance abuse disorder. Nationally, experts believe about 20 to 40% of people experiencing homelessness have a substance abuse challenge, but is rarely identified as the sole cause of homelessness. So one of the, when we've talked and had discussions, and I think you brought this up, David, too, is that it might add to the reason why someone might be homeless, but we have this idea in our head, and a lot of individuals, we talk, the reason why individuals are homeless is because they're they're using drugs or they have substance use challenges. But in reality, it could be completely different. And based on the data, it shows that most people don't believe that that's what led them to be homeless. So, so with that topic, Liz, you identified as a peer. Your organization works closely with individuals with substance use challenges. What are some things that are challenging when entering into recovery? Because I think hey, you need to get, in order to get housed, you need to not use substances, right? So what about that?
Yeah, absolutely. I mean, from a personal perspective, and then also just doing this work for 11 years, right? Like addiction is a beast. It's a beast. And, recovery is the one thing I think that requires somebody to change nearly everything in their life, essentially kind of all at once. So like, even for myself now, I think of the things that I want to change in my life. And I know that there are others that have things like our eating habits, right? The amount of time that we exercise or the way that we treat the people around us. But recovery was the one time in my life that I had to change literally everything. So like my social connections, the people that I interacted with, my living environment. I had to change the way that I coped with things like physical dependencies. And so I just think that it's extremely important that as providers, as people working in this area, we come from that position of support, and in leadership positions work to create programs that limit barriers, especially barriers related to accessing stable housing, as much as possible, so that individuals who are entering into the recovery arena and getting ready to fight that fight have the capacity to focus on all the other elements of their life that they're working to try to address.
Thank you, Liz. And then Dawn, do you want to kind of add to that?
Yeah, when speaking to housed community members, when their perception of unhoused community members, oftentimes is that people that are living on the streets want to live that way, or that the reason that they're there is substance use or mental health. But oftentimes it's a profound and catastrophic loss of family is a big driver for people finding themselves living on the streets. And so then oftentimes, we've heard and probably used this term service resistant, and thinking about why wouldn't somebody want to take these services? Why, it almost baffles the mind that why wouldn't somebody want help? Well, because oftentimes now they have found a tribe, a sense of family, a connection on the street, and you're asking them to leave all of that and then engage in this, just like Liz said, this hard work, this uphill battle all by yourself without your tribe, and then trust all of these people in health professions to be your new family. It's a really scary experience.
Definitely. Thank you, Dawn. Now, Vanessa, I know with the permanent supportive housing programs, and Andy has some experience in that. Would you guys like to share like the concept of that and kind of what that means?
Absolutely. So permanent supportive housing goes by the Housing First model, where regardless of any barriers that we reduce barriers. So regardless of any situations a person may be experiencing, if they have substance use, active mental health concerns, zero income, evictions, criminal history, regardless of all of those situations, we believe that that person has a right to housing, and we want to provide that to that person so that once they're in housing, they can take advantage of wraparound services and support services to help them to address those issues and maintain their housing. So that's what the permanent supportive housing model is modeled after, and we actually what ABC does is we have a great partnership with the behavioral health system where we provide the housing through our subcontractor Home Inc. And so we do the referral intake. We help them to find affordable housing in the community. And then once they are placed into their housing, they gain that wraparound support service from their clinical case managers so that they can be connected to any resources that they may need and just get that, that guidance that is needed throughout housing, because being a tenant is a skill set, right? You have to know how to pay your rent. You have to know how to work the thermostat in your house. And so there are different things that one has to learn after living on the streets for a long time. It's an adjustment. It's a big adjustment. So those support services are so important. Like I said, ABC has that partnership with the behavioral health system so the clinical case managers can really be the experts in providing that.
Thank you. Andy, would you like to add to that?
Yeah, definitely. I think that was a great kind of summary there, Vanessa, on permanent supportive housing, and definitely value that partnership. And just to kind of speak to the concept a little more, I think we were talking yesterday, Camilla, I'm not sure if you shared a respondent's story about how their access to drugs actually increased once they became homeless, right? And so maybe there was some underlying substance use happening prior to homelessness, but then all of a sudden it's like, ooh, what's that, or what's this? And then it can really compound really quickly. And I think Liz had mentioned too yesterday about coping, right? There's and Dawn talked about the burden that's bared on folks. And so using that as a coping mechanism, and maybe it can start to spiral. And so getting back to that housing first model, right? Let's take you away from all that additional things that you've now been exposed to and that additional traumatization. Let's get you housed and not ignore the issue, right? We don't want to just say, hey, we housed you, have fun, everything's going to be peaches and cream. Like, continue to address that. And I think, working with permanent supportive housing providers as much as possible. And, for our membership, we're always trying to connect to one of those 7 providers if that member is interested in those voluntary services. And there's also a peer support component of each of those service providers. And so really, again, getting back to tailoring it to those needs, but housing them first.
Yeah, definitely. In the work that we do, Mike and I, we see that day in and day out that an individual gets housed, but they maybe need those additional supports, to kind of maintain that housing. Maybe they need to get connected to some counseling, or there's some trauma that needs to be addressed. And, they struggle with the day-to-day things. They're used to maybe getting things in the trash. They bring it to their apartment. Apartments don't like that, and so there, a lot of different barriers that someone can encounter that can limit their ability to maintain the housing consistently. And then once they lose it, it's harder for them to get housing again because they've lost it. So, and it can become this cycle. So definitely. Joanna, we'll take Joanna next, and then we're going to move on. Joanna.
Yeah, thank you. I just wanted to add, I come to this conversation, from a policy and advocacy perspective. And this conversation right now is really relevant to some of the advocacy work that I've been doing. And it's been quite unfortunate that, the work that I've been doing at the local level around advocating for more affordable housing and, conversations around all of the funds that we have coming in from the federal government and how we can use these effectively. I've been met with some very stigmatizing comments, unfortunately, from our local leaders, and elected officials around drug use and homelessness, and there's this discourse around, we don't have a housing problem, we have a drug problem, and drugs are the root cause of homelessness. And it's very disheartening to hear, because we need our elected officials to be on board and really understand the issue as it is, and to kind of move away from the blame and the stigma, and to, understand the structural causes of drug use and homelessness, and the wider picture. And so I just wanted to raise that, if anyone does any work around advocacy or engaging with local officials, even when it comes to voting, it's so important to know how our local officials, elected officials, really view this issue. Thank you.
Yes, thank you. I mean, that's a good point. We hear that, like I said, we heard that a lot. When we actually met with police too that work with this population, and they said the exact same comment, that it was a substance use issue, and it's a lack of substance use resources, which, maybe that's a piece that they see, but is that the reality? When we talk to individuals, most individuals did not identify, they said they do use substances, but that wasn't what led them to being homeless. So, so definitely an important thing to bring up, and that we know studies show, multiple different countries, even in our own country, that when you get someone housed and you meet that basic need first, that the likelihood of them staying sober and finding recovery and, getting off the streets is, way higher. So versus focusing on substance use, then getting them housed, the opposite. So thank you, definitely. Okay, so moving on to the next area, what are some ways that we can help individuals that are maybe struggling with addiction or substance use challenges? So I know we talk a lot about, trauma or harm reduction. Liz, what are some areas that your work and your experience has with that?
Yeah, I mean, definitely the harm reduction approach. And, it can be challenging at times because we see sometimes like the way that we found success, or we're aware of ways that others have found success, but that doesn't necessarily mean that that's going to be success for the individual that we're serving. So, just being extremely open to hearing about their addiction and their goals with addiction. It might be that they want to stop using heroin, but they want to continue using alcohol. And we've got to be very cautious of the judgments that we place on them when they come up with these self-desired goals, because our judgment coming out could make it to where they no longer want to interact with us, and actually to kind of close off and no longer talk about their addiction with us. And so that harm reduction model is just extremely important. And then also, again, like from a leadership position, exploring the harm reduction model in our different resources. So Community Bridges offers low barrier shelter, where it is not contingent that the individual has sobriety to enter into the shelter. They can't bring illegal drugs into the shelter, or also alcohol, but if they come back intoxicated, we have staff that are trained to be able to assess them to see, is it something that's severe? Is it going to cause essentially like disorder in a congregate setting? Or can we assist them with getting to bed and not losing their shelter bed because of their addiction, but instead being a person and agency of support that walks beside them through that? And then in addition, just using those harm reduction models through the permanent supportive housing programs, really thoroughly training our staff on it. I think especially peers, because some of us get in such an abstinence mode, it becomes our entire way that we've obtained success in recovery is through complete abstinence. So having peers in position that are also supporting members through that harm reduction model requires a ton of conversation, a ton of training, a lot of just helping them see how it can produce successful outcomes.
Yes, thank you. Yeah, and I think that peer piece is a good component too. Having someone that's walked down that path, lived that experience, right? Dawn, talking about that piece and the expectations of what we put on individuals, why don't you share a little bit in that area?
Yeah, thanks, Liz, for that. The highlighting the ton of conversations, the ton of time spent with another person in building that rapport, building that trust, developing the picture of what their future is. It may not match with, me as the provider, but what their vision for the future is. And, the housing first model is so critical and so important, because we have had this expectation that people will thrive living in environments that are unthrivable. That's even a word. You know, but also putting somebody into a house that isn't enough either. Need that intensive support, and somebody that is relationship based for the long term, to walk alongside somebody as that burden becomes less and less and less as they start walking towards the vision of their best life.
Definitely. You know, before we move on to that, I mean, Mike, you're a peer, you work as a, you know, you've worked as a peer support. You know, what have you seen the value of that being on a personal and professional level?
As far as, I mean, having peer supports be able to step in and help walk somebody through recovery. You know, it was brought up earlier, and Joanna, it was brought up by a few different panelists, but Joanna had made a good point too, with like looking at the whole reducing stigma, and there's this whole stigma against really what the problem is. You know, as we were talking about this, what comes to my mind and what's deeply rooted in my heart is the sadness around addiction, and being someone who used to be addicted to drugs. You know, I used it as a form of escape, and against every single problem that I faced, I faced it with drugs. And you know, when we were out doing those interviews with individuals who were experiencing homelessness, that reality is so harsh, and you're in this pressure cooker of a place that all you can do to face it sometimes is, if you are actively using drugs, is to use drugs to get away. So, you know, you brought it up later, Camilla, that one of the things that we do in our program is we help somebody as they're in their home work on different things, and sometimes that is substance use. And so when we change someone's environment or help them change their environment, that's when these other things start to fall in place. And yes, going through on the road to recovery, we hit those relapses, or we hit those walls, but we learn, as like other things are starting to be okay around us, we learn how to face things without having to use drugs. And I think that's the starting point. Like it was brought up, the starting point is not first stop using drugs and then everything becomes better and, you know, glorious in your life. No, it's the other way around. Other things have to change.
Thank you. And David, you know, I think you brought it up a little bit earlier about like the urgency, you know, that most individuals, you know, only stay homeless for about 2 weeks or so until they're able to find, but you have some individuals that they struggle with that. So what about that urgency piece is important?
Yeah, no, thank you. Again, back to the original comment I made, that the vast majority of people reconnect, and I've heard a number of people make similar comments about the power of community, you know, and a lot of those individuals who get connected quickly, it's because, you know, maybe they just needed time to reestablish a family connection. Maybe they had some type of resource that they could go to. They had that support system. But one of the things they found is the longer somebody is in the homeless system and kind of cut off from the mainstream system, they're much more likely to become chronic. And so there really is an urgency, you know, on two levels. One, let's not forget that homelessness itself is deadly. You know, if you're homeless in Maricopa County, I think there was one study done a few years ago that your life expectancy is like 15 years less than an average house person in Maricopa County. You're more likely to be a victim of just about every single type of disease you can imagine, you know, not just the obvious ones like COVID, but, you know, heart disease and all those other types of health-based chronic health conditions are more likely if you're homeless. And that's you're much more likely to be a victim of violence. I think there's a horrible number that, you know, I can't remember what it is, but I think it's like 75% of people who've been homeless have been experienced some form of physical violence or threat as part of their homeless experience. And so we have a very physical, real danger part of that makes homeless an urgency issue, right, that we need to address. But then there's also this issue that if we really want people to be back into community, back into being into society, to have the best chance of being not just productive, but being housed and stable, we really have to treat homelessness with urgency. And that means getting people connected as quickly as possible back into the mainstream of society. And whether that means and that again includes individuals being released from home, in institutional settings. So as Michael has pointed out in some of our previous conversations, there's terrible numbers around the justice system that if you don't get connected out of jail within a certain amount of time, your chances of not just becoming homeless, but going back to jail go up dramatically. And a lot of it goes back to these social issues. If you're not connected to family and housing and jobs and positive things, your chances of going back to the negative behaviors of drugs or gangs or those other types of community that are there, or just meeting basic needs, become more prevalent. So we really have to think about homelessness with some sense of urgency. Again, both on the individual health level, but then also if we're really going to solve it, we have to treat it like the emergency that it is. So thank you for that opportunity.
Thank you so much, David. I think that you speak some very poignant points, and Vanessa, I saw you shaking your head, and I think that you guys see that day in and day out in the individuals that you work with, right?
Absolutely. I think that David is speaking to the urgency of that. Is every night on the street is dangerous. Every night, I think forget who was saying it earlier, but so you don't know what's going to happen. And so even with in permanent supportive housing, sometimes we have people in between units, and we work really urgently to make sure that they, if for some reason they get evicted, we don't exit them from our program just because, if that's the only reason, right? We work diligently to rehouse them, and we work to do it quickly. It's really important, but no, absolutely, that's you'll see, there is a difference between working with people who are newly homeless or people who are chronically homeless. There's different intricacies of support that is needed, but especially with newly homeless, you want to be able to connect them back into the mainstream as quickly as possible. And with chronic homelessness, really providing those skills I was talking about earlier of how to adjust back into living as a tenant and to maintain that housing.
Thank you. Thank you. So with substance use being a piece, we also wanted to talk a little bit about how it can happen so fast, right? So a study said Maricopa County saw an average of 47,000 housing displacements per year from 2014 to 2018, and pointed to three main causes for the high rate of losses: low wages, lack of affordable housing, and high population on fixed incomes. So none of this was substance use. Arizona had the highest rate of housing loss in the nation, according to a new national study. So, one of the pieces here, why do you think that Arizona is kind of uniquely positioned to have this kind of perfect storm? One of the things that I think is a lot of individuals move here from out of state. I know I've heard of that. I've heard of, I have a friend that used to work directly with individuals doing needle programs. And so they had said that a lot of states actually give people bus passes and send them to California and the Southwest. So other states send them over to this side of town. I just wondered, what do you guys think is what puts us in this position? Mike, why don't you go ahead? You have your hand raised.
I know that, I'm working with a couple different individuals right now, really closely. One, he's in a position that he pays his rent on time, doesn't cause trouble the place he's at. But recently the property was bought by an out-of-state investor, and they are doing renovations, and we can't even work out a deal with this new property manager to even pay more, pay what they're going to be asking for. They want this individual out, and there's not anything to help this individual other than advocating for them and trying to connect them to get into somewhere else, right? And so we're having a tough time with that. And I think when you look at the housing market right now, it's like on fire, right? And so this is happening not just with this individual I'm working with, or these couple individuals I'm working with. This is happening all over the state. Again, when we go back to those interviews too, that we were doing out in Phoenix, you remember the one individual, he brought up everything was good. He had a good job. He was an engineer, and he was engaged. Well, things didn't work out with his girlfriend. They ended up splitting up. He wasn't able to pay rent. Again, the low income, wasn't able to pay rent. So he lost that place, couch surfed for a little bit, and he just saw that progression happen. And sure enough, now, he's where he's at. So I think there's a few different things, and I would definitely say that the way the housing market is right now, and with property management, unfortunately, that's where we're at. That's why I think it's perfect for them.
Thank you.
You're on mute, Kenny.
Camilla.
Now it's my turn. I say, Dave, you can go next, and then Joanna, you can go after him.
I was just going to reiterate what Michael said. We're in an affordable housing crisis right now in Arizona, well, nationally and specifically in Arizona. City of Phoenix just released a report that I think they need over 100,000 units in Phoenix to meet the current need for just low income people, let alone people who are experiencing homelessness. Obviously, our homeless members are at the bottom of that pecking order in terms of resources to acquire housing. I think Zillow did a study that shows as property prices increase, it increases the rate of homelessness. So at its root, homelessness is a lack of housing. So there's a lot of evidence to say that this current housing market is causing a lot of problems. And one of the secrets that a lot of people don't talk about is during the Great Recession, which was focused on the housing industry, and the housing industry became affordable, we actually were reducing homelessness using these practices that we're talking about today, housing first, low barrier. We were able to house people for those years between like 2008 and 2013. We actually reduced homelessness every single year statewide. But with the return of this housing crisis, we just don't have the places to put people. In a lot of cases, there's voucher programs that may have capacity, but they literally cannot find places to rent to people. And then the last thing I'll just say, kind of to Michael's point, is in this highly competitive market with rents are going up 10, 15% a year. Landlords have the discretion to pick who they want to pick, and they can do it legally. So, a lot of places we're seeing landlords now are doing month-to-month rents so that they don't have to evict people. They can just not renew the lease if they don't like the person. We've seen deeper and deeper background checks, crime-free type programs where any criminal history bars you from renting. We've seen places that price themselves out of the voucher range. Vouchers can only pay up to a certain amount, like a HUD voucher, so they'll charge $100 more than that, so that they won't have to take, or they'll just flat out not take people on vouchers. They'll only take people with cash or payments. So it's just a really brutal housing market right now, and we really have to have these larger strategies around developing permanent supportive housing, just permanent housing in general, but affordable housing as well.
Yeah, and I just want to add, first of all, when you asked this question, Camilla, I paused because I'm like, there is just so much, like there's just so much going on that kind of answers this question. And Michael and David really, provided, the main issue is that we don't have enough affordable housing. And when we think about where we were pre-pandemic, we were already in an affordable housing crisis. We had high eviction rates. All of this has been exacerbated. The problem is just booming. And then when you add to what has just been discussed, the barriers that we have at the state law level, like we don't have a favorable landscape to build more affordable housing. We have barriers at the state law that bans municipalities from enforcing inclusionary zoning, which means that cities and towns can't forced, well, I guess, yeah, forced, I don't like that word, but can't force developers to include affordable units and have to find out figure out ways to incentivize instead. And then at the same time, when you have a booming housing market, why is a developer going to want to do that? It just doesn't make sense in terms of profit. And then we have things like, the short-term rental restrictions. The state law doesn't allow municipalities to restrict short-term rental. And so in places like Sedona and Flagstaff and Scottsdale and the high tourist areas, they've suffered so much housing loss to short-term rental because it's more lucrative to rent out your unit, on Airbnb than it is to a family or a household on a permanent basis. And there's just so much more. We don't have source of income discrimination, we don't have rent control, and so there's a lot of opportunity at the legislature to amend our laws to increase the supply of affordable housing, but it's such a huge challenge. Our political landscape isn't favorable. So
yes, thank you, Joanna. Yeah, and I think that's a point here is that it starts with our legislators are the ones that make those decisions and make those laws, and so going out there, talking about how people are discriminating. There's no real laws out there that keep individuals, from doing those things that you talked about, David, as well. So community legal services, we'll put in the chat. That's an area. One of the things we have found is that, sometimes if there is discrimination going on or, there is something, you do have the rights, and community legal services has helped individuals fight, those type of things. And the other area is that prevention services. So Joe, I know that you guys have worked with Mesa, and there was a program that you had talked about it with vouchers, kind of that urgency piece of someone. Do you want to share that?
Yeah, I guess, it is important. There are a number of different municipalities in the valley that are, taking homelessness head on and trying to put into place supportive services to try to reduce the impact of homelessness and increase housing. So in the city of Mesa, which began kind of during the pandemic and through some monies that were made available through the Federal CARES Act, they began to house the most vulnerable homeless individuals in a couple different hotels. And they have been working very closely with Paz de Cristo and Community Bridges on an initiative called Off the Streets. And that has continued into 2021. And the city of Mesa and the legislature there have really put forward an effort and a plan to try to help improve the housing for homeless individuals, and create kind of a pathway towards recovery. And they have all sorts of requirements and expectations of individuals that get placed into the program. But I think it's very innovative. It's been working, and they are interested in trying to make this a program that is longer term. Right now, they're hoping to have it, in place for 5 years. So they're committing resources and funding to try to help with, it's like transitional housing, and there's housing for individuals as well as families.
Thank you, Joe. Thank you. One of the other things here, pre-eviction, why is that so important? And what are some resources that we have that can help keep people housed, knowing that that urgency piece is there, right? That you talked about, David. So if we can stop them from having to go through all that trauma of what it means to be homeless. I mean, I remember how traumatic it was for me as a child. Like, you know, I thought it was a game. My mom would make it a game. It's fun. But as I got older and I remember back to certain things, you know, just the feeling of insecurity of not knowing if you're going to be able to have a roof over your head, where is your food going to come, where you're going to sleep. You know, in that moment, it might have been fun. But as you get older and process through things, it was very traumatic, you know, these experiences. So, you know, with that being said, what can we do to keep people housed?
I can answer this.
Yeah, go for it, Joanna. We're just going to throw it out there to you.
So, I mean, it's really important to keep people housed, you know, as our homeless services are just, you know, under huge demand. And especially through the pandemic, evictions has become such a huge topic of conversation, and there has been increased resources for eviction prevention. I just dropped into the chat there a link to the DES website that lists out the various eviction prevention resources. And these come from the stimulus funds coming from the federal government. And there's actually a few more rental assistance programs kind of hanging on from the CARES Act, and I'll drop another link in a moment into the chat. But also we have the CDC eviction moratorium currently in place. So the purpose of that is, you know, the CDC recognizes that, you know, it's very important to keep people in their homes through a pandemic, and that, you know, ties into the conversation around housing is healthcare, which has really been, you know, highlighted through COVID-19. But the CDC moratorium is in place until the end of June. It could be extended. I know our federal partners are pushing for that, but who knows until nearer the time. I think last time they decided the day before to extend. So we'll be waiting to see if that happens. But the moratorium stops the eviction enforcement stage. But it's not as easy as it sounds. There's certain steps to it. We need renters to be understanding their rights and, you know, trying to get legal assistance through community legal services and other places. Again, we have a summary of how the moratorium works, and I'll drop that into the link to into the chat box too.
Thank you, Joanna, for those great resources. Definitely. David.
Oh, I was just going to add to what Joanna said. You know, it's really critical right now. There are a lot of eviction prevention programs out there, but a lot of them have kind of complicated, not complicated, but they have eligibility requirements, you know, what conditions, you know, those types of things. You know, I think community legal services like Joanna put out in the city of Phoenix and a number of different resources have put out some really good guidance on making sure, you know, how you know, who's covered under the moratoriums, you know, how to leverage those things. Southwest Fair Housing Council is a really good resource too, for people who think there might be discrimination based on their housing, you know, being evicted or those types of things. And then, like I said, you know, DES, or like Joanna said, there's also the CAPS offices, local CAPS offices a lot of times. Again, each city or town might have its own strategy for that, but sometimes they have some utility assistance and some of those programs traditionally that can help people stay in housing.
Definitely. Yep. There's also Mesa Can. There's the John F. Long resources too. You know, with the prevention services, one of the issues that we've also seen is individuals having, like, you know, the kind of the story, like you said, Mike, trying to find, like, there's something that happens where they have to lose, they're going to lose the housing they have. And now they're in a market where they can't find housing. Maybe they have a barrier with some criminal justice challenges, or maybe some evictions in the past. And so now they need to find a new place, but they can't. Now, I know, Vanessa, how does your organization support individuals maybe that are having a difficult time finding housing, and they have a certain limited time with like a voucher or a program that they're in to do that?
Yes, absolutely. So when our participants enter our program, they are provided with some leads of different affordable housing properties that work with our program. So Home Inc. actually made a really great service called Pad Mission. It's kind of similar to apartments.com. And definitely, if you are not already following Home Inc.'s blog, follow it, because Mike Shore, the CEO of Home Inc., puts out these really great blog posts about landlord incentives, and they're doing a lot of work statewide on that. So I definitely encourage you all to follow that, because they are on the cutting edge of that. But so we're really fortunate to have them as a partner, where they provide that service to our participants, so that it's hard to find a landlord who's willing to work with the type of program you may be participating in. And it's hard when you're homeless to be able to jump on the bus and go talk to landlords and advocate for yourself. It's really difficult. And so we do provide that through Home Inc., but also ABC has housing advocates, where we will take them out and transport them to different landlords and really advocate with landlords. Why is it beneficial for them to participate in this program? And also how, it's about giving back to your community and really giving people a second chance. And a vast majority of our participants do very well and are great tenants. And so that's what we do to support our participants. And I would really encourage anyone. You don't have to be a housing provider to really support someone in their housing search. It's really, many of us have done our own housing search, and that's all it is you're going out and you're researching and finding a place that's affordable for your budget, and talking to landlords and really selling yourself as a tenant. Any case manager can help a participant do that. And I did want to just bring out, there are some about eviction prevention. There are some really great veteran resources. If you have a veteran participant, make sure that they're getting to the, oh my gosh, I'm going to forget it now, but probably Joanna could tell me the community resource, kind of like the coordinated entry. What is it, Joanna?
The CRSC.
Yes.
Yes.
Make sure they're connected there. There's so many wonderful eviction prevention and other housing service support for veterans.
Mm-hmm.
Thank you so much. And like we've all kind of said, eviction is kind of, we want to stop that from happening. So thank you for those wonderful resources. One of the other areas that we found some concerns or challenges, and I kind of touched a little bit on that, was the criminal justice piece. So recidivism rates say that if convicted felons can get a job and find a place to live, then recidivism goes down, right? Each year, approximately 700,000 individuals return home from state prisons in the United States. An additional 9 million are released from county jails. More than 10% of those are coming in and out of prisons and jails are homeless in the months preceding and following their incarceration. So among ex-offenders, those with mental illness have higher than average rates of homelessness and housing insecurities. So I know, Mike, that this is some personal area to you, and I wanted to maybe kind of open it up to you, start the conversation with this, and kind of, what pieces you feel that the community should know has been a struggle.
Yeah, in our previous discussions, I have a lot of little parts to my story that are near and dear to me, and each one has value in it. But I think one of the things I first want to express is that it really starts before somebody even comes home from being incarcerated, from being institutionalized. So before somebody even comes home, they may have spent quite a bit of time disconnected from their family or friends, and may not have the support system that they had or didn't have before they went in. And so here they are coming out, and before re-entering, there's a process with the Department of Corrections that they try to help people get have like a home and address that they're going to be able to go to. But it's not always the case that somebody's able to find it. And once that absolute discharge date comes, they have to release them as homeless. They designate them homeless. Now, when coming home, though, there are all the different barriers that somebody's met with, like getting an ID, reporting to the probation office, not even including a job. Hopefully, if they had something lined up prior to being released, they have that lined up. But if they don't, that of course is something that they're going to want to get into. All the different things that we could think of that they're going to have to do, let alone just wanting a fresh, good meal, right? something different, or let alone wanting a clean pair of clothes or a fresh shower. Having a home to go to is super important. So if they don't have that, they have all these other things going on, and then finding a home. So thankfully, there is the Second Chance Center, again endorsed by the Governor Ducey's office, that's been stepping in and starting a new program a few years back, and now they're doing a lot of good things. Hopefully, they expand it to where they're lining people up with jobs, with their social security card, with their IDs, sometimes their driver's license, with training, job skill training. In fact, they're able to even use the internet and the phone to be able to get hold of, get an interview done and get a job lined up before they get out. So a lot of great things are happening. Now, what I've found is that, what my family and I have found is that when trying to apply to different properties, we were met with nobody wanted to rent to me. Nobody wanted to rent to me, to sell to me, nothing, because of my criminal history and where I was just coming from. Now, digging a little deeper into this, we've learned that, they say that there's that 7-year gap of not having any sort of offenses that will show that you're just as equal as somebody who's never committed any offenses at all, any criminal offenses at all. But again, what we found was that we really had to advocate for, this is what happened, and this is how I've rehabilitated. And you have to show documentation, you have to show proof that you are a contributing member to society. So there's a lot of things that can be done, and thankfully, if somebody does their research and is able to really look further into what their rights are or aren't, they can arm themselves with knowledge and prepare themselves for those conversations that they'll have to have when seeking housing. You're on mute again.
I thought I had hit it. One of the other things that we have talked about too was that, and I think you brought this up before, was that, when someone is incarcerated for a long period of time, they save money so that when they leave, they can, ultimately pay for, getting into an apartment or something. And you had said that a lot of those places on the list or whatever that were given that said they will rent to individuals actually don't. And so they're taking those application fees or those fees, but they're not actually willing to rent to the individuals that are applying for those housing positions.
Yeah, that's what we had found and that's actually what HUD would come in and they would teach people about, was that these things were happening. Unfortunately, there weren't many protections against that because they would have to show proof that was actually happening. But the fact of the matter is that it does happen. And so, so to everybody on the call, if you are somebody who is looking for housing and you do have a criminal history, or helping somebody who is looking for housing that has a criminal history, just keep that in mind, that you can have conversations with property management ahead of time and have these heart-to-hearts with them before even submitting the application, and just ask them straight up, hey, listen, this is what I'm working with. This is what I can do. I just need to know right now before I put this application in, what are my chances? Because my credit's good, my money's good. I can even show I've been rehabilitated. I'm a good standing, contributor to society. But what are my chances? Are you gonna give me a chance here? Is this worth putting in right now? And obviously, if you get any sort of vagueness, I personally would probably step away from that and not not apply there, but seek elsewhere.
Thank you. That's great. That's great feedback, Mike. One of the other things too, I think, peer support is a good kind of avenue to connecting with maybe a peer that has that forensic piece. Denise did put a link to Don, you put a link to the forensic peer support training. They're also doing the family forensic peer support training that I think, Mike, you're actually going to help train that, right? So yeah, so that's awesome. So sometimes connecting to someone like Mike that has had that experience that can give you that great advice and that feedback, right, is a great way to kind of, hey, I got your back. I know what we can do here, and kind of support the individual and making those decisions. And hopefully the outcomes are a lot better because of that support. So thank you. So does anyone else want to add anything to this piece here before we move on? Oh, okay, so we're moving on to what should I do? So we had some questions coming up about vouchers and housing for individuals like low income housing. Like, how do people access these? What are vouchers? How do they work? You know, and how can someone get connected to these types of services? Some may be through an insurance, some may be through a community organization. And so I know, David, you had brought up how there's kind of like a lot of different programs and it's based on certain specific things.
Yeah, just in general, I mean, I think that's one of the really tricky parts about this is that there's lots of different programs. Usually the best place to start, like I said, in the homeless system starts, usually with these coordinated entry programs that Andy was going to talk a little bit about eventually. A lot of times the HUD is required that those units be tied to people coming through that system. So, they do the assessments and all those types of things. If you're a person with serious mental illness and you're in the Access REBA system, there's housing available for those individuals. Again, limited, there's wait lists and things like that. The public housing authorities, so most of the larger cities and counties in Arizona, through their housing authorities, have housing vouchers, and a lot of them are getting more through these various sources that Joanna and others have mentioned as part of the Relief Acts. So, places like Phoenix, Chandler, Mesa, most of the counties as well. Again, and you just have to kind of go to each of those programs, unfortunately, is the hard part. And again, just the thing to know, there's kind of different kinds of vouchers. The longest, there's permanent supportive housing vouchers, which basically provide somebody with ongoing support as long as they need it. That could be indefinite. It could be lifetime if they need it. There's a lot of programs out there right now that are rapid rehousing programs that will pay rental subsidy for some short period of time, sometimes up to 2 years, anywhere from a month to 2 years, to help people get back on their feet. And in that time, they would be accessing services to address mental health or substance abuse or employment or those things. But the key thing to know there is those programs will end at some point, and you have to have a plan for how you're going to sustain that housing. And then there's also, eviction prevention type programs to talk about where you can get maybe a month or two here and there, or deposit assistance or some of those types of things to help people, get into housing or stay in housing. But that's really the frustrating part, is that there's just so many different resources that are available. So it's really a matter of working with your case manager, working with peers, working with people who kind of know these systems, I would say, is a great way to get started, who knows some of those resources. I wish I had an easy answer, a magic wand.
Yeah, definitely. And I think you had brought up a point before, was about connecting to all the resources you're eligible for. So instead of just putting all your eggs in one basket, right? If you qualify for 5 different programs, right?
Absolutely. There's no penalty in most of these programs for being on multiple wait lists. And so, I can just tell you, Access's wait list in Maricopa County is like 2,000 people for, maybe 200 openings a year. So, get on our wait list. But if you're a veteran, there's the VASH programs, our permanent housing vouchers, and they have some other short-term assistance. Get on those wait lists. Again, if you're in a jurisdiction like Phoenix or a city that has a housing authority with vouchers, get on their wait lists. Just get as many of those things in place, because sometimes the wait list can be months, years, depending on your priority and what circumstances. So again, yeah, maximize your opportunities and get on as many of those programs as you can and start your clock ticking so that, you know, you're making progress.
Definitely.
Thank
And
you.
and Andy, kind of to loop you in with that, one question that I had for you was lots of times we see individuals maybe get on a wait list when maybe they're living with their aunt or their brother or their mom or their dad, right? And their situation may be a little bit different. Maybe they get kicked out and now they're homeless. And at that point in time, what should be happen to show, hey, my priorities changed? Should they, do they contact the organization? You know what I mean? Because we've seen that happen
Yeah,
where like I'm on a wait list
sure.
before I was in a different situation than I am now. And does that move them on that list?
Yeah, yeah, that's a great question because I mean, things like that happen quite a bit, right? And so my guidance there would be wherever they applied, going back and communicating that, right? So these housing authorities are really specific to localities, right? So Mesa Housing Authority is going to be a little bit different than City of Glendale Housing Authority and things like that. So it's not a one size fits all. And that's where David was saying it's just a complete nightmare because, you know, I want to give up even talking about it sometimes. But going back to that housing authority and saying, hey, look, my circumstances have changed because recently they will adopt like a homeless preference, right? Or I think there's some other couple preferences, right, with these mainstream vouchers. And so a lot of times that certainly will change their status, right? And so really keying in on, again, too, when those housing authorities open up their wait list, right? So all of a sudden you'll get an email, City of Tempe, our wait list is open for like 2 weeks and then it closes, right? And so trying to stay diligent on that stuff as, you know, mind numbing as it can be, because things change so often, but communicating that back. And then, you know, from the coordinated entry perspective, just to touch on that a little bit, I did put a link for at least a single adult site, and then sort of kind of what to expect at some of those different entry sites. But the nice thing about that is coordinated entry onboards all of those different housing programs, community resources, right, across maybe 25 different nonprofits. And so an individual can go get an assessment done, and then that's it. Like whatever they're eligible for, coordinated entry will do the work of matching them on the back end. Okay, maybe, you know, Native American Connections program doesn't have an opening right now, but we do have an opening at Save the Family right now. Would that be of interest to you? Or, you know, there's a couple different combinations of things that could happen. And so it's not that you're sending them on a goose chase, right, to Save the Family in Mesa and then Native American Connections in Uptown Phoenix. You get on one list no matter where you were, right? I know when I was at the campus, spent a lot of time trying to collaborate with great organizations like Community Bridges, Liz's team, and Paz de Cristo, and making sure, you know, we're outreaching all of those folks in the community so that way they're accessing folks. Folks are getting on that community list. And then behind the scenes, really trying to prioritize folks for whatever is out there. So it still sounds complicated, but it's a little bit less complicated than what it used to be, for sure.
Yeah, definitely. Thank you, Andy. Liz.
Yeah, I think that they've done an exceptional job just explaining it. But the thing I wanted to touch on too, and it's a bit of a hard conversation, but extremely important in case management is, you know, prior to us having the coordinated entry system and so many wait lists, you know, I feel like we took a little bit more of a sense of urgency when it came to the issue, and we're a little bit more creative with, you know, looking at the individual's Social Security, disability income to see, you know, what affordable units are there out there that the individual could afford with their income alone to kind of more quickly get them off the streets while they were on these lists, you know. So it's this constant conversation of, okay, let me get you on the list, but also let's look at your own individualized situation to see like what are the employment and career opportunities that maybe you have that I can help support you in? What are we working on your budget to see if housing would be affordable, and kind of opening up the conversation from that lens so that we're empowering the people that we're serving to be able to, I think, together, like, more creatively solve homelessness and get them indoors as quickly as possible, instead of just sometimes sitting on a list for an extended period of time and not really having anyone come in with that conversation. The other thing I wanted to describe a little bit more is just how vouchers work, if in the event some people on the, some of the attendees are not sure. So usually most of the permanent supportive housing vouchers and Section 8 vouchers are subsidies so that their rental assistance is paid. But what's really important is that 30% of that individual's income, they would be responsible for paying towards rent. And so we do see some barriers there from a permanent supportive housing perspective, because we've really got to work with our members to be able to come in and pay that portion of their rent up front each month, so that their, maybe $50 to $250 does not put them at risk of losing that unit, since the voucher is paying just the rest of that subsidy, not that full rental amount.
Definitely. Thank you so much for that. We do have a really good question from the audience. Belinda has a question. So she says, my mom has been in housing in Rhode Island for several years. She's disabled. She is over 60 years old. She would like to move to Arizona closer to me so I can help take care of her and get her into housing. How does that work? Can she start the process from Rhode Island and have her information transferred? What does someone do in that situation?
I would say it depends on what program she's in. Some Section 8 vouchers are portable, so meaning if you're in the voucher program for at least a year sometimes, and I don't know how Rhode Island works, so this is just general knowledge, but they can request to port their voucher to a different housing authority, so they would have to talk to their housing case manager about that. But again, it would all depend upon that program and the availability to move your voucher, if it's a voucher program.
Definitely, that's a good point. So what program is she currently in? If she is in a current program, maybe find some matching program or see if that can be transferred to another state. Good point. If she is not in a specific program, but maybe in some senior living per se, we've seen good success. Someone else had a question about what is the forecast of senior housing, so maybe this can kind of roll into that. We've seen good success with working with some senior assisted living locator services that their job is to find housing that meets someone's specific needs. Someone with very low income Social Security, they'll work with, there's different types of senior housing. Some are harder to get into that cost less, but some of those senior locating services, and we'll put some of those in the chat, that can definitely be beneficial for that as well. And they don't cost anything. You can literally call them and someone will walk you through and connect you to places that will take your income, your medical conditions, or the family members, and they'll even help with the paperwork and the whole process. So it's actually really nice. So one of the things we did find too is someone is not on Alltech. Some of those agencies, if they do qualify, will allow them to live and help them get on Alltechs with a certain period of time. So that's another thing that the senior locating service will find those agencies. If someone maybe is struggling with getting on Alltechs because they just don't have the supports to get the paperwork done or to turn stuff in, maybe they don't have family to support them to do that. Maybe a case manager struggling with that. Some of these agencies will take them, and then the care staff will assist them in qualifying for Alltechs. But they do have to meet the financial, and they have to look and assess certain things and make sure that they meet the qualifications and that there's no real reason of why they wouldn't get on that. So definitely. Any other things in regards to that question, or maybe some senior resources that we currently have? One other thing too, and then maybe Andy, you could touch a little bit on this. I know that we have the Bridgewater program. I don't know if you know a whole bunch about that, but it's it's a program that works with individuals over the age of 55 that only takes individuals that are designated SMI, correct? Or I'll let you take that one. I don't know.
Yeah, I will take it, but I'm not gonna take it and like score a touchdown with it, because there's
Okay.
probably actually I'm seeing some attendees on here that would know better, because the criteria for Bridgewater, and I apologize that I don't know it, but I'm not gonna give
Okay.
you
Sorry
false
to throw you
information.
out
We can
there like
certainly,
that.
no, we'll certainly find that out, but I know they certainly work with individuals that do have an SMI determination. I know they kind of do a broad array of services, but there's some criteria there as well that I don't want to get wrong, but I think we could definitely find a link for that.
Mike, do you want to put in the requirements? I think we have that in an email somewhere when I got a while back. If you don't, I'll find it and throw it in. But yeah, from my knowledge, and I'm only speaking from my knowledge, is that the individual has to be 55 or older. They have to be designated SMI to qualify for this specific Mercy Care funded program. They don't have to qualify for all tax. It goes based off their income. So, and they can have one pet that has to be 20 pounds or less. So they can take a pet with them. And they have different levels. So if someone just needs some support, but if someone also needs more health related stuff, they have different levels that the person would qualify for. So we've helped a couple individuals get into this program. It's a pretty quick process once you turn all the paperwork in. And I was recently told that they are opening up another facility because it's been so successful. So it is definitely a good resource if someone has some health challenges, they're aging, and they lack some supports, that maybe this is a good option for them. So definitely. Okay. Yeah, no problem. So moving on to the next piece here, how can we get involved, to make some changes? I know, Joanna, you've talked a little bit and put some stuff in the chat. David, previously in conversations, you talked about the system and connections. Why don't you start with that? Like what specifically can we do to get involved in moving this needle forward?
Yeah, I know we have a really mixed audience, and all of us have different capacities and resources and knowledge and things. And so, I don't want to how do I say? I don't want to turn against anybody's perspective or focus on. Again, all of us can do different things with whatever resources we have. Just generally speaking, as like a system provider, as access, and somebody who's been on the homeless, shelter side, I think one of the things that we really have to think about is, this housing first model and the focus on housing. Let me just start by saying that, from my experience, pretty much every single homeless person I've ever met has the potential to live independently and successfully and dignified in housing. There's a very small number of people, just because of their maybe medical conditions or their mental health conditions, may need to be in assisted living. They need, some type of higher level of just clinical support. But the vast majority of people that I've encountered, I've seen thrive in housing when they're provided, just like you and I, with the right supports in the right housing setting. And so with that, I think, as a provider, or those of us in the role of being in the position of trying to help individuals, we really just need to listen. We need to open ourselves up to, what are they looking to do? What are they looking to accomplish? We think we design these perfect systems, but a lot of times we don't inform them by the actual experience of the people who need to use them. I was joking yesterday with the group that, unlike Amazon, who does everything they can to get me my delivery as fast as possible on my terms, right? Like, I don't even have to leave my house anymore. They'll knock on my door for me, right? We make these systems to put all the burden on the member and all the burden on people who have all these challenges and have the least ability to overcome those challenges because of maybe their incomes or their behavioral health needs. And so we really just need to have that customer service focus. And that starts with listening, understanding what they need, what are they trying to accomplish, rather than trying to decide make those decisions for them. I may have a substance abuse problem, but that doesn't stop Amazon from delivering my package, right? If I say I need clothes, they deliver me clothes. They don't make a judgment value on me. So, and that's how our system should be. We should be looking for ways to be creative and responsive to the needs of our members based on how they identify them. And again, with that goal that we should be working together with them, again, to get them into housing and into these solutions. So I apologize for the preaching if it sounds preachy, but I really believe strongly in that.
No, I thank you, David. And I think that that's, a good point to take, and I think a lot of you have brought this up, we're all human, and with Dawn, with that being said, with, David talked about the system, right?
Yeah.
And I know that that's something that's near and dear to you.
Definitely. I mean, I love what you said about, service providers listening to the people that they serve. And, in my role, thinking about how we as service providers can listen to one another, how we can link arms, how we can better link our policies so that there are less gaps, less redundancies for people to retell their story at every stop in the way. And so that's why these forums are so important, where we come together, we're all from our different lenses, working towards a common goal. And, the issue that we face is a crisis, and it's overwhelming and exhausting for the service providers. And, stay inspired, stay involved. I keep this in my office to keep me inspired. Like, I'm looking for, this is a sign I hold, system transformation. And when I just want to have a plug here for self-care. We all do great work, and there's important and heavy work ahead of us. And every day that we take great care of ourselves, we fill our capacities to do this work and carry the baton forward.
Definitely. Thank you, Dawn. And, Joanna, I think that, you working in a completely different country, seeing things from a completely different lens, and a lot of us have, what's your perspective on that piece?
Wow. Well, yeah, certainly. It was a shock when I came over here, because I'd worked in homeless services in England for like 6 or 7 years. And I kind of just expected things to be similar, but it's very, very different. So, the way that the welfare system is set up in Europe, is favorable in comparison. I was shocked when I came over here that, I went to work for a family program, and I couldn't believe that children were actually sleeping in cars. That was a real shock to me. So it's been a steep learning curve to sort of learn about, the resources that do and don't exist. But what I do find here is that the compassion of the providers is incredible, and there's such a good, boots on the ground, and, so much collaboration between partners and stakeholders, because I think, there has to be, to really work hard on this issue and to serve the individuals that need the help. So I think that's great. But also I do want to mention too, sort of in terms of how people can get involved, is right now, we have a lot of funds coming in from the federal government for housing and homelessness, and there's a great deal of opportunity to bring more units of affordable housing online, however that might look. There's a lot of conversation around having to be really innovative in this time, looking at converting hotels into housing, for example, leveraging the unused buildings that we now have, like office space, etc. How can we be creative? And there's opportunity to combine that with supportive services. There is funding that can fund support services alongside bringing more units of housing online. And it's very hard to get your head around all of the money that's coming in, but I would just recommend, keep your eyes open for like public comment from the cities, the state, local municipalities around this funding, and perhaps just keep engaged with the conversation. Because I think if we raise our voices, that this is a once in a generation opportunity for us to really bring more affordable housing units online, more support services. This is what we need. And if we can move together on that, hopefully we could make an impact. So anyone can get in touch with me as to how you can stay involved and up to date on the funding conversation. Thank you.
Thank you so much, Joanna. Thank you. And I know, Liz, with CBI, I mean, you guys have really taken on this space in some really creative ways. But how could someone get involved, from your perspective?
I mean, it's a great question because it's just so necessary, I think, like just for providers, but then also community members, constituents to, work to reduce stigma and become an active, advocate for the people that are suffering in our communities. And that's how I really think we do get to change, because it speaks a little bit to what David was talking to with Amazon, right? Like, if we were able to have this for me, it's like this for-profit kind of mentality, right? That is invested into like Amazon and NASA and all of these different things, right? This worldwide competition and channel all of that energy and innovation and our skills and everything towards ending homelessness, we'd be done. So I think first and foremost, just open your eyes to the people that are experiencing homelessness in your community. Don't see through them, see them, even just make a brief comment to them. And then from a provider perspective, I love working for Community Bridges, and I'm so familiar with COPA, providing amazing one-to-one services to some of the FACT and ACT members. We just get this ability as peers to work for an organization that takes risks and allows for us to open low barrier shelters that allow individuals who are currently intoxicated to come in and go to bed and have a peer support specialist, support them through that. So just, from a leadership perspective, be an advocate for innovation. From a provider perspective, see the people, listen to them, hear them. And from a community perspective, just open your mind to the suffering of others. And for me, every night when I lay in my bed, I'm so grateful to lay in my bed, and I'm like, oh yes, I've been waiting for this moment. And then I think about the people that I've been on outreach, and I want to work every single day to try to make them as comfortable as I am when I sleep.
Thank you, Liz. Thank you. I think all of us working in these roles are not doing it because we want to be millionaires, right? Yeah. So we all have a passion of something that really we want to give back to the community, and it just shows in everything that we do for those that we serve. So thank you so much. As we end, I'm going to take a couple questions from the chat here. And then if any of you are willing to share your contact information, if anybody would like to get in contact or get connected to your organization, please feel free to put that in the chat. So how is Arizona working with the USICH and looking for other states for ideas and collaboration? I have no idea what USICH is. Does any of you know?
USICH is the United States Interagency Council on Homelessness. I think there's something like 17 federal agencies that have homeless programs. And so back to the point you've heard over and over again about the need to collaborate and bring systems together at the federal level, starting with, I want to say it was under Bush or Obama. So this is not a partisan thing. This was done by both sides of the aisle. They created this entity that basically brings together the leaders of those 17 agencies to try to do some of the collaborative work that you've heard discussed today. So, syncing housing vouchers up with supportive services, making sure food stamps are available to people in homelessness. The VA is tied into these other efforts, all around this focus on permanent supportive housing and ending homelessness. Yes, absolutely. USICH participates in Arizona. Various stakeholders in Arizona have been invited to interstate sharing events. They hold events in Maricopa County or throughout Arizona on a regular basis. We have a liaison for our district that you can contact to ask questions. They put out material. If you go to their website is an excellent resource where you can look up like other states' best practices, other states' models and demonstration programs, funding programs. I would definitely, and if you want to look at the research, they have a lot of research postings on, best practices and things that are working in other states. So, and the data. about how housing's going. So it's a great resource, and it brings together a lot of different stakeholders.
Thank you, David. And someone brings up advocacy for homeless court. Do we even have that? What is homeless court? And then that can help recidivism rates. They think that we can get involved by providing community awareness through mental health first aid trainings, anti-stigma trainings, panelist discussions, kind of like what we're doing today, and CIT training. So that's another way of getting involved. But what is homeless court?
A number of communities, I'll let other people add, but a number of communities, and some of them do it collaboratively, have set up special courts for persons who have tickets or legal, like civil matters related to their homelessness, public indecency, those types of things, or minor tickets or fees, or even sometimes, unpaid ticket can result in a arrest warrant or, some type of ongoing legal consequence. Basically, members can get there's usually a case manager who helps them apply for this. But if they go through the court process, usually in exchange for like staying in a shelter, maybe getting involved in substance abuse programming or job search, the judges in the homeless court can legally expunge, tickets and fees and things like that, so that the member can, the person doesn't have those things on their record when they look for housing, or doesn't have to pay those fees that a $200 fee to a person with no income can be life-ending, right? So anyway, I know you can access it at one point. I think you can still access it through the Human Services campus is one major location where you can access it. And I believe some of the you can access it through some of the other court systems, local court systems. And others, please add. That's 2 years old information based on my memory.
Thank you.
No, I think you nailed it, David. It looks like some other folks are, the chat's popping off as
blowing
well.
up. Yeah, awesome.
Talked about the court in Mesa, and Liz shared some stuff too.
And Joe, I think that you had a partnership with Copa Health too, and where there was like a navigator program. Is that still happening? I know it was stopped for COVID, but is that still going on?
Yeah, most definitely is. We actually used to hold a community court here at Paz de Cristo, but that was suspended during COVID. But the city of Mesa has resumed that. It's a community court to process kind of misdemeanor charges, as David was speaking about, and Copa Health through their navigators do assist the individuals kind of to work through the court system.
Yeah, thank you. Yeah, my brother was struggling with substance use challenges, and he was homeless. He was living with us, and he had some misdemeanor charges that I told him about your court. This was maybe a year and a half ago, 2 years ago, but it was in Mesa. So he went there, and the judge took one of them off and lowered one to he could do community service. So got rid of all that. He was able to work through it, get a job. He's married now with a little baby. So
great program. It really is a great program.
Awesome. Thank you. Thank you. Well, I want to thank everyone for joining us today. There's a lot of amazing resources that we shared. And what we're going to do is gather this from the chat as well as what's been said through the call. We'll be sharing that sometime next week. It's going to take us some time to kind of put all this together. And we want to make sure we capture everything. So it'll also be posted on the Mental Health Awareness Coalition website. Throughout this year, the Mental Health Awareness Coalition focuses on specific populations and educating and anti-stigma campaigns. So this is kind of where we're going this year. So if anybody wants to get involved with us as well, feel free to join our member meeting on our website. There's a way that you can sign up and get connected to that. And then I believe everyone that was wanting to share the information has put that in the chat. So if you want to take a moment to share that, and if there's anything else that you guys want to share before we end, any last words about getting involved or how they can get connected to your services, please feel free to pop that, and then we'll go ahead and end. So thank you Thank you so much for everything. One of the things too, I do want to kind of plug the Arizona Peer and Family Coalition. Dawn's a part of, I'm a part of. Getting connected to, and some other individuals may be getting connected to some other coalitions like our coalition, or maybe the Arizona Housing Coalition with Joanna, getting connected to these coalitions where we're kind of working to move the needle forward with, community action and collaboration is definitely beneficial. So please, please do that if you have the time. We'd love to have you join one of these coalitions, I'm sure. So thank you, everyone. And everyone, thank you for taking your Thursday night. I know we have a great Memorial weekend, so stay safe. And I want to thank everyone for their time. And this will be posted on our Mental Health Awareness Coalition website, as well as the Facebook page next week. So we'll get this all posted up. So feel free to share. And we look forward to further conversations from the community. Thank you.
Thank you.
Awesome. Thank you all.
Thank you. Have a good night.
You too.
Thank you. Good night, everyone.
Thanks, Joe. And thank you all attendees for joining as well. Thank you so much.